Hello, friends. I am Dr. Sushant Srivastav, a senior resident at Pandit Madan Mohan Malviya Shatabdi Hospital, Mumbai, and I am here to talk to you about unicondylar knee arthroplasty. The knee joint is one of the most important joints in our body. The knee joint is made up of the articular surface of the femoral condyle and the articular surface of the tibial plateau. This is made somewhat like this, with the patella, which is one of the largest sesamoid bone in our body, anterior to the femoral condyle and the tibial plateau. So if you see the knee joint, it moves like this, which is like a hinge joint. As you know, the fibula is placed lateral to the tibia. So we have the medial compartment, the lateral compartment, and the patellofemoral compartment. So it's very important for us to understand that whenever there is going to be an arthritis, it can be a femorotibial arthritis, it can be a patellofemoral arthritis as well. A femorotibial arthritis can be a medial compartment arthritis or a lateral compartment arthritis. The arthritis which is painful and is also debilitating. But also, there is something known as a femoropatellar arthritis. So, when it comes to the knee joint, there are three types of arthritis we should know of: the medial compartment arthritis, the lateral compartment arthritis, and the patellofemoral arthritis. When it comes to the knee joint, the most important component or the important compartment which bears a lot of stress is the medial compartment. If you have seen the femoral condyle, the medial femoral condyle is larger and broader in size as compared to the lateral femoral condyle. This means the amount of friction, movement, as well as wear and tear will be more in the medial compartment of the femur as well as the medial compartment of the tibia. So, as we all know, there are three different types of arthritis. That is the medial femoral compartment arthritis, the lateral femoral compartment arthritis, as well as the patellofemoral arthritis. So, what do you mean by the unicondylar knee arthroplasty? Unicondylar knee arthroplasty is a type of arthroplasty which is done for the anteromedial surface. That is the anteromedial surface of the femur. It involves the medial compartment of the knee joint. So what happens in this? The anteromedial surface of the femur is replaced with the medial part of the tibia. And here we can see the implant which is used for this. Now, where did this unicondylar knee arthroplasty come from? What is its history? Way back in the 1950s, McKeever and McIntosh formulated and postulated the idea of a unicondylar knee arthroplasty. But let me tell you, this was very different from what we are thinking. We may be thinking right now that they would have gone ahead and replaced the femoral medial condyle, but something very different happened. What they did was they replaced the medial tibial condyle, and this led to the production of a medial tibial condyle prosthesis. As we went forward, there was the St. George and the Marmor knee, which came ahead. In 1972, Boston, in the United States of America, came forward with basic research in unicondylar knee arthroplasty. Now, in 1990, Thomas Thornhill and Richard Scott developed the unicompartmental knee. Now, this design was a little bit more better. It had a all polyethylene component. The tibial tray was better and more adapted to take in the modular surface. So what did this do? This helped in accommodating the femoral component or the femoral part and led to less wear and tear in the component. Thomas Thornhill and Richard Scott went ahead to formulate and postulate the unicompartmental knee arthroplasty guidelines. Richard Scott himself came out with a book on total knee arthroplasty. Now, this brings us to the indications for unicondylar knee arthroplasty. Now, it is very important to understand that the indications for a unicondylar knee arthroplasty is very different from a total knee arthroplasty. Mind you, unicondylar knee arthroplasty is a little bit more minimally invasive surgery. So, the indications are isolated medial compartment disease, that is one. Second, age less than 60 years. Low physical activity of the patient. Weight of the patient should be less than 82 kgs. And the cumulative angular deformity should be less than 15 degrees. Now, we can see in this X-ray that there is a medial compartment disease. Now, what do you see here? We see that the medial femoral surface and the tibial femoral surface has a lot of wear and tear. Also, the angular deformity, which is the angle between the mechanical axis of the femur and the mechanical axis of the tibia, should be less than 15 degrees. That is, either in a varus or a valgus deformity, the angular deformity should be less than 15 degrees. After the top 5 indications, we come forward to the next 5 indications, which says number 6, both the cruciate ligaments, that is the ACL as well as the PCL, should be intact. A preoperative range of flexion of 90 degrees should be available at the knee joint. The flexion contracture at the knee joint should be less than 5 degrees. There should be minimal pain at rest, and there should be no radiographic, mind me, radiographic or intraoperative evidence of any chondrocalcinosis or patellofemoral arthropathy. And as well as there should be no inflammatory arthropathy. Now, inflammatory arthropathy over here means there should be no condition of a rheumatoid arthritis or a SLE in this patient. Now, if you see, look closely, flexion contracture at the knee joint means the deformity which is sustained even at the normal resting position of the knee. The next X-ray which is put up here shows the deposits which give rise to chondrocalcinosis and the patellofemoral arthritis which we know of, that is the arthritis between the posterior articular surface of the patella as well as the anterior femoral condyle which makes the patellofemoral surface. Now, after the indications comes the contraindications. The first major contraindication to do a unicondylar knee arthroplasty is active infection. The second is inflammatory disease. Now, the third one is very similar to the first indication. In the first indication, we had read about the intactness of the ACL as well as the PCL. So, any ligamentous instability will be a contraindication to unicondylar knee arthroplasty. And the last contraindication is high tibial osteotomy. Now, what is this high tibial osteotomy? High tibial osteotomy was, or rather, I would say, is still a soft tissue procedure. Well, it is not entirely a soft tissue procedure. What happens in this is the condition is the same, that is, the medial compartment arthritis. We make a high tibial osteotomy cut We take out a bone wedge and fix it with a Pudu plate. And this is how we do a high tibial osteotomy. So the four contraindications again: any active infection, inflammatory disease, ligamentous instability, or high tibial osteotomy. Now, after we have done the surgery, we come forward to the complications. The complications of a unicondylar knee arthroplasty can be a bearing surface, that is, the bearing surface dislocation. There can be any aseptic loosening. Now, there is a condition if you're using a cemented process or a cemented prosthesis, there can be something known as a aseptic loosening. Also, there can be polyethylene wear and tear of the implant which you have used. There can be a periprosthetic fracture, that is, a fracture around the prosthesis. There can be a progression. Mind you, you have done a unicondylar knee arthroplasty for the anteromedial surface of the femur. But what about the lateral surface? So there can be a progression of the contralateral lateral compartment, or there can be an infection. So these are the first 6 major important complications of a unicondylar knee arthroplasty. Now, after the first 6 contraindications, there can be a bone implant impingement. That is, you've put the implant here and the bone is over here. There can be a bone implant impingement which is giving rise to pain. There can be retaining of the cement debris. Now, in case you are using cemented implants, there are two types of implants. It can be a non-cemented prosthesis or a cemented prosthesis. Now, if you're using a cemented prosthesis, there is always a chance of the cemented debris lying in the knee joint or around the implant, which is giving rise to irritation and pain at the joint. There can be an ankylosis of the knee. There can be recurrent hematoma, collection of blood, which is hematoma, and there can be any persistent pain. Now, mind you, this pain can be because of any reason. So the 5 later things which we have studied of, that is the bone implant impingement, the retaining of the cement debris, the ankylosis of the knee, the recurrent hematoma, and the persistent pain, can also wreak havoc as a complication of a unicondylar knee arthroplasty. Now, in this slide, I have tried to give a comparison between a unicondylar knee arthroplasty and a total knee arthroplasty. As you can see the X-ray properly over here, in a unicondylar knee arthroplasty, as we had discussed before, the medial compartment, that is, the medial femoral condyle and the medial tibial condyle has been replaced. In the total knee arthroplasty, both the femoral condyles and the tibial condyles or the tibial plateaus have been replaced. Now, this is for anyone to understand and know that if a total knee arthroplasty is compared with a unicondylar knee arthroplasty, how are we going to differentiate them? What are going to be the pros and cons? So first, the pros of unicondylar knee arthroplasty. Unicondylar knee arthroplasty is done. It is cases of medial compartment arthritis alone. It is less invasive. It preserves your cartilage and knee. It maintains the normal knee kinematics. Now, as it is less invasive, you should understand that the complications or the soft tissue damage will be less. There will be a quicker rehab to the patient as there is less amount of soft tissue destruction as well as soft tissue damage. A unicondylar knee arthroplasty can be gone ahead and changed into a total knee arthroplasty. Now, these are the pros of a unicondylar knee arthroplasty. We come to the cons. It's not that every other person will be adept or will be well trained. So it's a very, very, very specialized procedure, because if you see, this is the femoral condyle. Okay, this is the tibial condyle. Specialized procedure, that is one. There is a higher revision rate. As you remember, we have already discussed. There can be a chance of a contralateral compartment arthritis. So higher progression rate of osteoarthritis. So these are the pros and the cons of a unicompartmental knee arthroplasty. For a total knee arthroplasty, well, it is a very well established procedure. We know it's very simple. The femoral condyle is gone, the tibial condyle is gone. It's a well established procedure. It is a less specialized procedure. You have a better survival rate, and there is no progression in OA. How will there be a progression in OA when you have actually not left any parent bone standing in the knee joint? The cons is it is more invasive. Trust me, it will be more invasive. The time to go ahead to rehab will be slow. There will be more restriction to activity, and also a total knee replacement being a big surgery. There is, or there are, I would say, chances of high rates of mortality. So if you see in this comparison of a unicondylar knee arthroplasty and a total knee arthroplasty, the basic take home messages are: a unicondylar knee arthroplasty is less invasive, you can go quickly to rehab, and the cons is it's a very specialized procedure and it should be done by a person who's trained in it. And second, proper selection of cases is of utmost and paramount importance to do a unicondylar knee arthroplasty. In case of added reading, you can refer to the Total Knee Arthroplasty book by Richard D. Scott. And these are the two articles which are of great value, which have the current trends, concepts, and all the indications and contraindications which I have included in this talk inside them. This is the third edition of the Total Knee Arthroplasty by Richard D. Scott. No matter what happens, in whichever state you are in life, this is a quote which I have written and I believe in it. Keep your chin up and face life. Thank you for patient listening and all the best.